I call the member for Hunter.
No, thank you very much, Mr Deputy Speaker. Having spent 3 years throughout the course of the 43rd Parliament trying to wreck this joint, the Prime Minister now in government is determined to wreck the country. There is much bad news in this budget. Bad news for pensioners, bad news for the unemployed, bad news for family, bad news for motorists, particularly bad news for those living in rural and regional Australia. But I cannot think, frankly, of anything more threatening to those living in rural and regional Australia than a diminution of our health workforce planning. There is no greater role for any government than the provision of affordable health care services to its people. Nothing, maybe other than the defence of the country, is more important for the broad community. And the abolition of the Health Workforce Australia is a backward step which undermines our capacity as a country to properly plan our health workforce and therefore properly deliver health services to our people. We have an ageing population in our health workforce, like so many areas of our economy, and that's posing a bigger challenge than ever before. And following a Productivity Commission report, I know those who sit opposite, including the Minister at the table, are fans of the Productivity Commission. I'm happy to say, as am I. This was not a lightning bulb idea from the former government. Health Workforce Australia was a considered policy proposal, first from the PC, then of course considered by COAG. In other words, an agreement by the then Labor government here in Canberra and each of the state governments around the country. Because it was a good idea, Mr Speaker. It was a good idea for the first time having some real policy-based strategies to our workforce issues. Now, in my electorate, Mr Deputy Speaker, for many, many years, the first 10 years, almost of my 18 years in this place, there was no bigger issue than the capacity of people to get to see a GP. Now, people who live in the capital cities, including people in this place, wouldn't understand this concept. In most capital cities there's a doctor, GP, on just about every corner, Mr Deputy Speaker. It's the reason bulk billing rates are so much healthier in the capital cities, in most areas at least, because there is competition amongst GPs. We're lucky just to see a GP in rural Australia, Mr Deputy Speaker, but thankfully, with the advent of the Rudd government in 2007, that situation has dramatically improved. It's improved because of initiatives from the former Labor government. It's improved because we've taken health workforce planning by the nose and done something about the issues. And today, I'm happy to say, in places like Cessnock and Maitland and right throughout the Upper Hunter, it's not always easy still to see a GP, and bulk billing rates aren't what I would like them to be, but they are much better than they were for the first 10 years I was in this place, including throughout the period the now Prime Minister was Minister for Health, an appalling period in health policy in my experience. Now, it's not just GPs and the capacity to see them, it's the training of GPs. I've always said the best way to ensure that bush communities, rural communities have a GP or two and hopefully three is to train people from the bush, the people who are most likely to go back and live and practice in the bush. And that's why we were making sure more rural students had an opportunity to do medicine. We were of course, training and funding the training of more nurses and other clinicians, and I fear this is all going to be unravelled as a result of this government's approach to health planning. Now, I fear for our Medicare locals, Mr Deputy Speaker. When a doctor unexpectedly leaves a rural town in my electorate, I go to the Medicare local. They are the people who understand the structure of our health workforce in the Valley, in the Hunter Valley. They are the people who know where to go, whose door to knock on to find a replacement doctor to provide the relevant incentives, etc. If Medicare locals go, it will be a big hit on GP services in my electorate. And this goes to another point, and it's a point I made in this place yesterday. You cut $80 billion out of the budgets of the states, it will have ramifications and knock-on effects. And I'm asking myself whether the state government of New South Wales is today willing to pledge that despite these cuts from the Commonwealth, it will maintain all the public health services in my electorate that we've enjoyed up until this point. I fear for Kurri Kurri Hospital, for example, which has been a marginal hospital because of the size of the town, but a hospital that delivers important local community services, including some specialist services. Will the state New South Wales government agree today that Kurri Kurri Hospital or any other hospital in my electorate will be protected despite these massive cuts? And it's a question all those who sit opposite and represent rural and regional areas should be asking their Prime Minister today. The member for Braddon, the member for Eden-Monaro, and I should say I was pleased to see the member for Eden-Monaro at least had the courage to talk on this bill. One of only 4 on his side, only one of 4 in here defended despite their huge backbench, only one of 4 backbenchers in here prepared to back this proposal to abolish the Health Workforce Australia. I want to guarantee from both the Prime Minister and the New South Wales Premier that no public health services will be reduced in my electorate as a result of both that $80 billion worth of cuts and what they are doing in this particular bill. I am opposed to this bill, absolutely, Mr Deputy Speaker. It's a backward step and it should be rejected.
Yeah.